Another tool that we use in the assessment process are physiological assessment instruments. We're talking specifically here on this slide about drug tests. Now, there are many ways that you can do drug tests: a tissue sample, hair, blood, saliva. By far the most common in the substance abuse counseling field is urine screening. Saliva is increasingly becoming cheaper to be able to test. It's less invasive, but we're not quite there yet in terms of its representation in the field. Urine screening is by far the most common form of physiological assessment of drug and alcohol use that we currently have. And the urine screening process can be a little bit of an invasive one, unfortunately, for clients, because with most agencies, what happens is the person needs to be physically monitored when they're giving their urine screen. So like, for example, you're going to see a video in a moment of someone who's giving a drug test, but they're doing it at a medical testing facility, like a LabCorp type situation. And you may have had that happen before if you've ever had to apply for a job and you get sent to give a drug screen. You go into the bathroom by yourself, you come out with a cup, they test the cup, yada, yada, yada. Well, in drug and alcohol counseling agencies, oftentimes that's not the protocol they follow, because it's, I don't want to say easy, but it's possible to cheat a urine screen, to bring in clean urine from somebody else who hasn't used drug and alcohol and submit that as your own. And there's all sorts of instruments out there that are designed to help keep it at body temperature, so that when you give it, it's not too cold and it doesn't set off alarms with the attending staff member. It's if you ever get interested, Google it, because there's a lot out there. So what has to happen usually in substance abuse facilities is the person needs to actually be watched peeing into a cup. And usually what will happen is male staff members will supervise male clients giving urine screens, and female staff members will supervise female clients giving urine screens. And you actually have to watch the pee, for lack of better phrasing, come out of their body, right? So it's kind of a tough situation to navigate. Ideally, you have one designated staff member who does that function. But sometimes as a client, the counselor will have to actually watch the person, which kind of sets up a weird kind of boundary thing later on, because you're watching this person pee into a cup, and then you're going to go and talk to them about their their life thereafter. It's kind of an awkward thing at times, but you manage it as best you can. So I wanted to show you two videos, one of which I already mentioned, kind of the routine outpatient thing. And what you're going to see in that first video is you're going to see the instant screens. So they have these little litmus tests that can be placed down into the urine, and the way that they are kind of manufactured, they can detect the presence of metabolites of different types of drugs. The second video that I'm going to offer to you, and you don't have to watch it if you don't want to, but is going to give you a feel for how extreme these urine specimen obtaining protocols can be. It's going to have some Olympic athletes who talk about their experience in giving urine screens and how pretty invasive that process can be for them. So in substance use facilities, our collection process is somewhere between the first video and the second video. These are more kind of the polar opposites of giving urine screen and collecting them. So take a look at these videos, and then we'll finish up with the last couple slides for this chapter.